I can confirm that we have 1,036 Victorians who have been diagnosed with coronavirus, and that is an increase of 68 from yesterday. Sadly, a woman in her 70s has passed away as a result of COVID-19, bringing Victoria's death toll to 5. There are 57 confirmed cases believed to be related to community transmission. This is a significant increase from 39 yesterday. There have been more than 49,000 tests that have been conducted to date. So just in terms of some quick announcements, firstly I'm very pleased to announce that we have struck a deal with Victoria's major private hospitals. This deal will see our healthcare system, both public and private, operating as one in our joint effort to combat COVID-19. What it means is that we will be able to utilise the capacity, the beds, and there are 9,000 beds in our private hospital system, as well as 170 ICU beds, as well as the staff of the private hospitals to add to our public hospital system. And it will ensure that we will be able to utilise our private hospitals during the peak of the pandemic, relieving pressure of our busy public hospital system. So I want to thank our private hospital operators for the very constructive way in which they have engaged with the Victorian Government around these issues. So what the deal means is, as I said, 9,000 hospital beds, including 170 ICU beds, 200 emergency medicine beds, will be added to our public hospital system, and they will be working as one, and it will be us able to direct how patient flows work both in and out of the public and private hospital system. It will not matter whether you have private health insurance, everyone will be treated equally, and we will be able to utilise the full extent of those private hospital operators. Importantly, it secures many hundreds of thousands of jobs for Victorians as well. We are going to be able to utilise all the nurses, the medical staff in our private hospitals, as well as, of course, the porters, the cleaners, the cooks, security guards and everyone else who works in our health system. So this is going to be a significant addition to our capacity, as we announced yesterday, together with the Premier, a very significant expansion to our intensive care unit capacity yesterday with a $1.3 billion package, but we're going further than that and also adding all of those additional beds through the private hospital system as well. I'll move on now to some further announcements, if I can, and that is just to let you know that we have had, of course, a huge effort underway now for some time to recruit the workforce that we will also need to staff all these additional beds. And I want to inform you that in the last few days I had mentioned that we had established a dedicated portal on the Department of Health website to receive expressions of interest from clinical staff and others to help us with our efforts around COVID-19. And I'm very pleased that just in a matter of days we've had over 4,000 people who have registered their interest to step up and come back to work and to assist us during what will be a very challenging period. And I want to take this opportunity to thank each and every one of those individuals for putting their hand up. We have worked very closely with APRA as the national regulator to ensure that they are contacting retired healthcare workers to refresh their registration and make sure we can cut through all the red tape and be able to bring these people back online as quickly as possible. So APRA is contacting those individuals, and we've asked them to expedite that for Victorian-based retired healthcare workers. And then those healthcare workers are going onto our portal on our website and registering their interest. We'll then be looking to match up their skills with health services across the state. So there's one further announcement that I wanted to make, and that relates to the flu. And we want to remind Victorians that each year, sadly, we lose many Victorians from the flu. The flu can cause serious illness and also death. So it's important that whilst Victorians are rightly concerned about coronavirus, that they also get their annual flu jab, and we're going to make it easier for people to do that. So from yesterday, Victorian pharmacists have been able to give a flu vaccination to children aged 10 years and up. It was previously 16, so we're making it more convenient for families to be able to present to a local pharmacy and be able to get more members of their household vaccinated. The other change that started from yesterday is we're making it easier for pharmacists to participate in workplace-based immunisation programs. Up until now, it has been nurse immunisers who have been able to go into various workplaces and provide people with the flu vaccination. Now pharmacists will be able to do likewise. So they'll be able to leave the pharmacy, go into local nursing homes, make arrangements with employers to go into workplaces and provide the flu vaccination to their employees. Now, this is important as we're harnessing effectively all our parts of the health system in our response to COVID-19. We're making it easier to free up nurse immunisers to do other work, effectively enabling pharmacists to play an important role in getting the community up to date with the flu vaccine. I just wanted to stress a couple of things, and that is I'm hearing anecdotally that many employers are cancelling their workplace-based flu immunisation programs this year as we've got more workers working from home. And it's really important to stress a couple of things. It's important that those workplace programs do continue. It is a legally valid reason for people to leave their home and attend their workplace if they are participating in a flu vaccination program. It is medical care, so it is one of those four valid reasons for people to leave their home if they're going to the local pharmacy or their GP or a workplace to participate in a workplace immunisation program. By making this change and giving pharmacists this additional role, we're actually going to make it easier for both workers and their employers to organise these flu vaccination programs. So it's important that people continue to get the flu jab. The last thing people want is the double whammy of both COVID-19 and the flu at the same time. It'll mean people will be incredibly unwell, and we want to make sure that, given that we have a vaccine for the flu, not for COVID-19, that people protect themselves as best as they can. So just with that announcement as well, I should also add that we've brought the age down for young people down to 15, for pharmacists also to administer other vitally important vaccines such as measles, mumps, rubella, meningococcal ACWY and whooping cough. So they will also be able to administer those vaccines to young people 15 and above. There's just one further matter that I'll add, and I know that Brett will be wanting to speak further to this, and that is from today, Victoria has widened its testing criteria. In recent days, we are seeing a decline in the number of return travellers, and of course, since the weekend, implementing a National Cabinet decision, we are now forcibly quarantining return travellers in hotels around our state. This has meant that fewer return travellers, of course, are having the potential exposure of infecting other members of their family. So we're seeing a corresponding decline in close contacts as well. So that's a positive development, but it means that we will now be shifting our focus on testing a wider group of people in the community. So Brett, as Victoria's Chief Health Officer, has expanded the testing criteria beyond healthcare workers and vulnerable groups, return travellers and close contacts to also include key public-facing workers such as police, disability workers, as well as patients in high-risk settings. So the additional workforce classifications that are now included are police officers, child protection workers, homelessness support, paid or unpaid workers in healthcare and residential care and disability settings, as well as immunocompromised, immunosuppressed patients admitted to hospital and patients in high-risk settings such as military operating settings, boarding schools, prisons and correctional settings. So this is a significant expansion of testing, and we also have expanded our testing capacity as of yesterday, with Melbourne Pathology being now the third private testing laboratory in Victoria able to undertake testing, and so we do believe that our testing capacity will continue to increase over time.